me the opportunity to ask a series of questions to the Minister for Health. And I would like to congratulate him on his appointment. I'm confident that he will continue the good work that the former minister had started, initiated, and the minister before that. My series of questions are in relation to an article that appeared in yesterday's national newspaper. Health workers I strike over 18.2 million in unpaid allowances. So I'd like to ask the minister what his ministry is doing about this and how did this come about. For health workers to go on strike, it doesn't happen automatically because they are duty bound. They swear an oath to serve, protect lives, save lives. And so for them to go on strike is a serious matter. It means that they've exhausted all their avenues, that they have been ignored, they haven't been heard, etc., etc. So therefore we need to address this immediately because the repercussions are significant and borne by especially the most vulnerable in our communities. So can the minister please elaborate how his ministry intends to attend to this and what he intends to do about it and when? My other question, through you, Deputy Speaker, is in relation to the PAC recommendations. The PAC report was delivered in 2020 after an inquiry under the chairmanship of Honorable John Pudari, and a significant inquiry had been carried out exposing significant corruption in the National Department of Health, particularly to do with procurement of drugs and the distribution of these drugs. We would like to know, we meaning the people of Papua New Guinea, not just those who were out of the Public Accounts Committee at that time and delivered the report. We would like to know, through you, Deputy Speaker, whether the Minister intends to continue with the implementation of these recommendations which are taking so long. It's been almost 4 years, and many of these recommendations have not even been implemented to any satisfaction. Ministers past have tried, but for some reason, the key recommendations to review the procurement system have not been carried out to satisfaction. I'll give one example. There was a particular logistics company that was highlighted as being a company that just did not have the wherewithal, did not seem to have the care of duty to deliver drugs to its locations that it was supposed to do so, and to do it in a timely manner. It was recommended that this particular company not be re-engaged. That company is still operating today and is engaged by the National Department of Health. And it is still doing these terrible practices. Oro is a victim of this. So, Minister, what are you going to do about the recommendations by the PAC and in particular to this particular segment of those recommendations? Those are my series of questions, Deputy Speaker. Thank you.
Honourable Minister.
Appointed me as the Minister for Health. And I acknowledge the effort that were done by the former ministers with these in these important discussions. I'll start with the PAC, the Public Accounts Committee report on medical supplies procurement and distribution. Mr. Deputy Speaker, the department has in place a working committee and have started to look into or to implement the 15 recommendations that were in the PAC report. And I will present to Parliament the full report on what the department is doing to address these particular recommendations. Secondly, with regard to the newspaper article yesterday, that is to do with the outstanding log of claims of payment to the Allied Health Workers Association. And the Allied Health Workers Association comprises of the pharmacies, the dental staff, the pharmacy staff, pharmacy, dental, radiology and the physiotherapy staff. The Department of Health has 7 cadres of health workers, health unions, and you can say that it is a highly unionized department with 7 cadres of health workers, with 13 different allowances that are configured in the Elias Kapavore system. What we've done, Mr. Deputy Speaker, is the department is in consultation with the DPM to make sure that the allowances that are in the claims must be verified and justified properly, especially the domestic market allowances and the housing allowance. That is ongoing discussion now with the department, Treasury, DPM, and the Labour Department. I say Labour Department because, Mr. Deputy Speaker, I have come to realize, or I've been informed that the office bearers of the Allied Health Workers Association has lapsed in 2021, and the office bearers who are actually taking the lead in this particular matter, they need to go through new elections for the office bearers before they can start leading their team into this matter. But what I say today, Mr. Deputy Speaker, is we are in consultation with Treasury and DPM and making sure that we meet this log of claims going back to 2012, and it's not 18. According to information I've received from the department, it's 12 million kina, and I want to say that we're not deliberately ignoring this particular matter, but we make sure that we are in compliance, making sure we check the figures and we comply so that we sort these matters accordingly. I want to say going forward, we'd like to see that some of these allowances must be captured in the Elias Kapavore system, so that they must be paid out every fortnight, not to be accumulated anymore. There shouldn't be any accumulation of such allowances in the system. Like this one, Mr. Deputy Speaker, we're going back 2012, and we want to put a stop to this. That's the first thing that this department is doing, and the second thing, because of this matter, it's not only the Allied Health Workers Association, but it's now revealing to us different other, as I've said, we have 7 different cadres of health workers in the department. In the department, we have initiated an audit for the human resource managers for the 21 PHs. We need to have competent PHs running the PHs in the country. We'll conduct a PHS audit, especially the HR section, so that we have competent HR managers who know their job and are working according to what we need to see. The current regulations of the PHA, Mr. Deputy Speaker, the CEOs of PHS are now required to forward to the department a quarterly report on their performance, on the budget implementation and the HR matters, and that is also to do that. That is also to see that we are making sure we report on HR matters as part from financial matters. That's a mandatory requirement under the amendment that was done by the PHA Act, and I again commend the former ministers for making sure that we do this. My other point, Mr. Deputy Speaker, going forward in the future is I see the need to have a health service commission similar to Teachers Commission, so that they look into this kind of matters. It is important that we establish a health service commission for the country, so that it is similar to Teachers Commission, and many of these issues can be deliberated in this manner. Mr. Deputy Speaker, I seek the cooperation of the Allied Health Workers Association to work with the department to see that we sort this matter amicably and not to go into strike action. It is the Mara Barroso government stands committed to paying the salaries and the allowances and everything that is captured for in the MOAs, and let us work amicably to solve this matter. As I said today, that